Welcome to Love Your Money, Max.
Thanks for having me.
I am eager to have this conversation. I wish, of course, we didn't have to have a conversation on such a topic, but as we all know, people are are sort of foisted into all kinds of situations. One of those being the potential health limitation, diagnosis, or injury of a loved one, which means that they may need extended care. And so you have a personal example, a personal situation that kind of drew you into this line of work. Let me just start by asking you, tell me about how that was for you. What happened?
Yeah, so I've been in digital health for most of my career. And as COVID started, like so many others, I moved into the home with my family. And I was working at this startup that was a telehealth platform for a chronic condition that helped lower the barriers to accessing quality care. And as I moved in with my family, unfortunately, my aunt was diagnosed with terminal cancer. And so
Oh,
I saw my parents put their lives on hold and really make caring for her their number one priority, and I wanted to contribute in any way that I possibly could. So at night, when I wasn't working on the telehealth startup, I was looking for resources online, support, different companies that could be helpful, insurance benefits to really just provide my parents as the primary caregivers some sort of support. And what I found was a really broken system. And I remember vividly having a conversation with my parents about other families and what they might be going through in a similar situation. Questions of, could this derail a plan for a kid to go to college? Could this delay retirement? Could it throw a family into bankruptcy? And that's what inspired me to start Givers, where we hire, support, and pay family caregivers to allow them to sustain themselves while they care for a loved one.
I'm so sorry about your aunt. How long were they providing care for her, may I ask?
They were caring for her for over the course of 2 years during COVID.
Oh, wow. So I think being such a hands-on person, I think if I were thinking about how to help my parents care for my aunt, I might say, how many days a week do I need to take off work and show up at the house to actually physically provide care? But was it your work experience in digital health that led you to kind of trying to figure out the regulatory morass, or why was it that it was, inspired was inspiring to you to take action?
So it was the middle of COVID, so we were being really careful about who would go
Oh,
over and take care of
oh
her,
my
especially
goodness.
given her vulnerability. So my parents were doing everything they needed to stay quarantined so they can get in the car and drive from Florida to Atlanta and take care of her. And it was just so tough to watch them. And I wanted to do anything I could while I was at home. So I was really the one just thinking about supporting the caregiver, knowing that they were there to support her. And I realized that we have a saying at Givers that the burden of caring isn't the care itself, it's everything else that surrounds it. And I
Mm,
learned that firsthand. And if you can help family caregivers find support, whether financial or not, it can help allow them to be more present. And I know with my own parents, there was nothing more that they wanted to do than be in the room sitting next to my aunt, taking care of her. What they didn't like doing was stepping out of the room and taking a phone call or going onto an insurance website or dealing with the different things they may be looking up at that time. And so I was trying to play that role for them.
mm. Wow, yes, I remember all the restrictions on action on moving around the world from COVID. I can't even imagine the things they probably couldn't even go grocery shopping. So, what are you in the time between then and now? What are you most proud of that you've developed at Givers? What subsection of people who are giving care are you most able to provide resources for? What does that look like?
So when I went through this experience with my family, I started to ask myself, how might I be able to scale my experience that I had in just my household to the entire country?
Hmm.
And there was a whole process of learning involved there. And what I saw was really eye-opening. And it was really this underbelly of family caregivers who actually make up 53 million Americans that are taking care of their loved ones sort of outside of the lines, sometimes not discussed and sometimes taken away from work. And I saw there's enormous costs involved in care. Family caregivers spend over $7,000 out of pocket per year on caring for their loved one. If they're caring for a loved one with dementia, for example, it's over $10,000 per year.
Mm-hmm.
And there's also opportunity costs. They're giving up wages. They're less productive at work, or they may even drop out of the workforce. And so when I decided to start Givers in 2021, what I really wanted to do was find a way to provide financial support where there was a lack of information and a lack of resources. I read a story at that time that Arizona had launched a program to provide $1 million to support family caregivers. And after a number of months running that program, it is essentially failed. They failed to distribute the money. And the problem was that people didn't know about these benefits. And
Wow.
so that's really what became eye-opening to me, was that there's support out there. The problem in many cases is about accessing the support. And so what we did at Givers is we built a free tool that's kind of like a TurboTax, where any caregiver anywhere across the country, from any financial background, any demographic, any zip code, can come onto our website at joingivers.com, answer a few questions, and get a really personalized recommendation to programs that are available in their area that they appear to be qualified for. And we'll tell them how to actually navigate their way towards applying. And then in some specific states, we're actually able to hire, support, and pay family caregivers. So if you're caring for a loved one who's on Medicaid, for example, and you've needed to actually move in the home with them, and you're providing more than 5 hours of care per day, so caring for your loved one has become a full-time job, that's where we can come in and actually hire, support, and pay you so that you can sustain caring for the loved one. So we've really seen the whole spectrum, from Medicaid, lower income individuals and families who are struggling with making ends meet and the ability to sustain care, all the way up to higher income families who are self-funding all of the care that they're providing or paying for out of pocket. And they're realizing that this is making a big impact on their financial sort of longevity or plans. And they're looking for things that can be helpful to them in remedying those costs.
So then being on Medicaid or being extremely low income isn't necessarily a prerequisite to receive public resources. Is that accurate?
That's right. Yeah, every state in the country has regional area agencies on aging. These are local regional entities, and one of the national mandates for these area agencies on aging is that they offer caregiver supports. Those supports can come in the form of respite care, counseling, financial assistance, Meals on Wheels. So there's programs that are available to every person, no matter income level, that in any state. And then there are some specific programs that are targeting populations of lower income, whether they're offered through Medicaid or a private grant program.
Oh, I have so many questions. I can't even imagine what it's like for you as a company, as an entity, to take on trying to learn the legal morass of every one of 50 states. Is that what you're doing?
Yes, that's what we did. It was a ton of time and energy, but we mapped the entire country for all of these different programs. And because I've been there myself, we didn't want to just say, here are the 4 programs that exist in your zip code. We're asking you the questions, and we're algorithmically finding out what are the ones that you seem to be qualified for. And then not just that, here's the phone number to apply. And when you call that phone number, you're going to need to dial extension number 2 to get to the person you want to speak with. So really what we realized is caregivers do not have the time or energy to jump over these hurdles. And so if you can lower those barriers for people, they'll be able to access the support that they need. And it's a win-win for everyone that's involved, right? The caregiver gets the support that they need to be able to show up every day and care for their loved one. Of course, their loved one benefits from that. And then also the state and the government benefits when we're able to provide sustainable long-term care in the home rather than institutional settings that are so costly and places that people don't usually want to end up anyway.
So I played around with your Finder tool. My 8-year-old daughter actually had a pediatric diagnosis, but that diagnosis wasn't on your list. So I started thinking about what I wanted to talk with you about. What have you found are the diagnoses that are most likely to make you entitled to public funds?
So there's really 2 sort of categories here. And I think I'm sure you've heard the term sandwich generation, which is people who are taking care of elderly parents and children. And I like to call that generation actually the caregiving generation, because they're caring on both sides of the spectrum. And those two sides of the spectrum really represent the two subsets that we see most often, which is elder adults often dealing with Alzheimer's, dementia, or physical disability. And then we also see children with intellectual and developmental disabilities. And when you look across the country, those are the two populations that are really being targeted with these programs. And so every state has its own flavor of programs that can support those two populations. But generally speaking, those have been identified by Medicaid, Medicare, health insurance as two of the populations that are most dependent upon family caregivers. And so those supports are coming to exist now.
Okay. So, and forgive me for my naivete, but specifically with your aunt who had a cancer diagnosis, which of course led her to probably limited activities of daily living, et cetera. Were there public funds available for her diagnosis in that situation based on declining ability to manage her own activities of daily living? Or, I mean, because so many people have cancer, Max, right?
Yeah.
What did you find?
Unfortunately, she declined too quickly, and so those programs weren't even going to be helpful. But what I did find for cancer specifically is that in most cases, those types of supports are offered through private grant programs. So some hospitals may have a program, some states may have, a nonprofit that's running a program. And so what I would suggest for people dealing with that sort of diagnosis is to talk to a case manager at a hospital or talk to a social worker at a local agency and see what support is available. The number one thing I've learned in this entire environment is that you won't get what you don't ask for. And so if you can find just the right person to ask for support, sometimes it takes 10 minutes. And I know when you're a caregiver, those 10 minutes are precious and they're hard to come by. But if you're feeling that financial strain, they're well worth the time to just kind of find out what's available.
I'm thinking specifically of a couple, they're clients of mine, and, income close to $400,000, caring for young children, as well as one of their parents is quite ill and living with them. And, they just always seem, first of all, I know they're resource stretched, but each time I see them and talk to them, they seem more energy stretched, like the saying, burning the candle at both ends. It's like, they've educated, professional, hardworking, career building, and yet it's sort of all being taken from them.
Yeah,
this is just goes out to them.
This is the caregiver burden that millions and millions of Americans are dealing with quietly. And even when you're talking about the wealthiest of individuals, they're dealing with the stress of, hey, I had this plan. I thought that I did all the right things, and now I can sail off into the sunset. And next thing you know, you run into a family situation and you're rethinking all the plans that you had made. And it's stressful. I mean, every family goes through it no matter what level of the income bracket they're in.
Yeah. What are some of the more interesting, creative ways, if you have insight into how lots of families are dealing with this kind of situation? What's a more surprising or impressive thing you've seen people do in terms to mitigate the individual or concentrated costs of caregiving?
One of the things that I've actually seen is sort of a pass it on group where there's durable medical equipment, whether it's crutches, wheelchairs, any sort of heavy duty hardware that a family might use temporarily, and they can pass it on in a Facebook group. And so I've seen these informal groups been stood up between a bunch of caregivers. And I think that that's one of the most creative solutions I've seen, because when you look at that $7,000 plus that's spent out of pocket, in many cases, hardware is driving a lot of that cost. And so I would say if you need one of these, a bed or a wheelchair or some sort of durable medical equipment, I would say check out your local community groups, whether it's a Facebook group or somewhere else online in your neighborhood, because a lot of the time people have used something maybe for 6 months, maybe for a year, and it's still in pristine condition and you can get free use out of it.
That's really interesting. So the way you've described it, with the money being available but not claimed, and also private and public funding and sources and things being sort of really nuanced and anecdotal, reminds me a lot of scholarship money paying for college. There seem to be a lot of things that this topic has in common with that, and there's no way around it. But yeah, just to reinforce what you said, you don't get what you don't ask for is like ask for something 100 times, maybe ask 100 different people. I'm sure you'll get 100 different responses, but perhaps a path to something you didn't know existed. Okay, so your company is called Givers, and you have, or do you, is the app live, or are we doing the website tool now?
We have the website tool and an app live. So the website tool is free, available for any caregiver to use across the entire country. They can come answer a few questions, find out what programs they're eligible for and how to apply. And then our app is what we actually provide to the caregivers that we hire. So when you get hired through one of these government programs, there's a lot of work that needs to go on between us and the caregiver to make sure that they're getting paid and supported. And so that app is where they can document what they're doing on a daily basis, chat with a coach, access trainings, and then also access their pay.
And what's the range of compensation these folks are earning?
So these programs vary. In some states, they're hourly rates, and they can be anywhere from $15 to $20 something. And then the programs that we serve, generally speaking, are actually stipends. So they're on a per diem basis, and those stipends can add up to $2,000, if not $3,000 per month, tax free. And so that's one of the really unique things about these programs that we're serving is they're actually considered foster care sort of programs. And so the income made through these foster care programs for the caregiver is actually tax-free for them.
Oh, wow. That's nice. I mean,
it's a really big benefit, and we're working with the Medicaid population. So when you think about, how much someone may be making at a job already, maybe making minimum wage, and they're paying taxes, and then they're also paying out of pocket for mom or dad to get care, the math really can add up for a lot of people to make the switch into these programs. And what we find is, generally speaking, we don't have to really convince anyone to join this program. Once they understand the math behind it all and look at the opportunity to be in the home every day with the person that they love, it's a clear answer for them.
yeah. And so if someone's listening and Medicaid isn't something they know much about, would you share, and I know you don't hold yourself out as a Medicaid expert, but how does someone know if they should consider being on Medicaid? What sort of period of time would that be? And what does that mean for them financially if they really see themselves having a wealthy financial life in the long run? Does being a Medicaid person limit that? What would you say about that?
Yeah, so I will caveat, I'm not a Medicaid expert, but I've learned a lot in building Givers. So, and the 101 is really important. Sometimes we need to just clarify the terms here, because I know when I started, I didn't understand the difference between Medicare and Medicaid.
Right.
Medicare is health insurance offered through the federal government for people over 65 and with some specific conditions otherwise under 65. Medicaid is focused on lower income individuals across the US. It's the largest health insurance program in the entire country. During COVID, there were up to 90 million people on Medicaid. And so that's a federal program that's run at the state level. So every state has their own rules, but it's all funded in part by the federal government. So to qualify for Medicaid, you need to be below the federal poverty line. And so you need to be making, in many cases, less than $2,000 per month. And you'll also have to have a certain amount of limitation on your assets. So there are strategies that I don't know too much detail about, but that concern spending down in order to qualify for Medicaid.
You're talking about elder law planning. Yeah.
Yes. So I wouldn't claim to be an expert on it, but what I've seen is if your family is kind of stuck in the middle where you're not able to pay out of pocket for all of these costs, but you're just above the cusp of Medicaid, I would say consult an elder law attorney and potentially look into spending down in order to qualify for Medicaid, because Medicare does not cover long-term care as much as we think it would for an insurance plan that covers long-term older adults. It doesn't offer long-term care. Medicaid does. So you have to qualify for Medicaid to have the insurance kick in for those types of benefits.
So it's conceivable that during a period of time where you choose or feel that you're forced to leave your job in order to provide care for a sick or disabled family member, that you and or they could be on Medicaid during that period of time. And then once that need is resolved for whatever reason, you could go back to a normal, you could be rehired, you could have private healthcare insurance. It sort of could be a phase of life.
Yes, and Hillary, you made a very good clarification there. They are the one who need to be on Medicaid. So if you're caring for your mother, the program is offered through her Medicaid. And so that's actually a really good point to make, is you don't have to be on Medicaid yourself to be the paid caregiver. Your loved one needs to be on Medicaid.
Okay. And I'm going to say this incorrectly about elder care planning. We'll do, I'll put a point about this in the intro, but essentially there are ways to strategize having your assets either not be in your name or be held in different ways so that it doesn't look like you're a rich person, which of course you're not if you're providing care full time rather than building your career. But it's a well-known strategy. It's all above board, and elder care attorneys do that. Okay. What would be something you've seen someone or typical stumbling block that you would kind of warn people against? What do you wish people would know?
Well, the first thing I would say is it's the emotional burden of caring. And I know this is a money podcast, but money is tied to emotions.
It's called Love Your Money.
Right. So to me, the first thing I always see is emotional burnout. People are stressed, people are tired, people feel guilty for the way that they're feeling about caring for a loved one. And I would say, know that you're not alone. Know that your coworker, your neighbor, your friend may also be dealing with the same thing, and there's support available. So that's the first stumbling block, is really about identifying yourself as a caregiver and coming to terms with the situation. And then from there, it's really about accessing resources is the big barrier. And that's why we exist, is really to help bring down those barriers. You can go to joingivers.com for free, but you can also go to your local area agency on aging. You can call your loved one's health insurance. You can talk to a social worker out of a hospital or a physician's office. A lot of experts do exist to help you find resources. Like we said earlier, the key is asking.
Amazing. Is there anything you want to mention today, Max, that I haven't asked you about?
No, I've had a great conversation with you. I appreciate you having me here.
Yeah, I appreciate your time. I hope this is of use to you if you're listening. And we'll put links to all of Max's resources through his company, which is called Givers, in the show notes from today's episode. Thank you so much for being here. Oh, Max, I forgot. I have a question for you. Signature question, which I ask everyone who comes on the show. Yes, it is a podcast about money, but of course, our emotions are intertwined with almost everything we do. So for you, and we haven't talked about your money much, but of course, you have a money life. If your money were writing you a love note, what would it be thanking you or acknowledging you for?
I think it would be thanking me for being patient. I had the pleasure to run the New York Marathon a few years ago. And one of the things that I learned during that marathon is that you can't run mile 22 on mile 5. And just being patient, especially as a startup founder, wanting to see success in the future and feeling like what you're building is so inevitable and so needed. It takes time, and being patient and knowing that you can, take it one day at a time, I think is a thing that both benefits me and my money.
Thank you for sharing your wisdom. I appreciate it.
Thanks.
All right. Good luck.